Thank you, Mr. Chairman, and we certainly appreciate you. You're not going anywhere, though, for a while, and we need you around here to keep Senator Tester under control. It's a big job. But thank you for holding the hearing, both of you all. This is an area that I believe that everybody on the committee is working on some project or working in unison. As most of you know, Senator Tester and I sponsored a bill in the last two Congresses to provide a way for veterans who served in Thailand to get benefits in health care. I believe that they've been left behind by the current limitations on the presumption of toxic exposure to Agent Orange. It was an Arkansas veteran, Bill Rhodes, who first brought this policy inequity to my attention. Mr. Rhodes served in Thailand, was exposed to toxic chemicals, now suffers from an Agent Orange-related illness and can't get the VA to consider his claim for benefits. The VA currently limits service-connected benefits to veterans whose duties place them on or near the perimeters of Thai military bases. The VA says that only those veterans might have been exposed to the harmful effects of toxic chemicals. The current policy further limits the possibility of exposure to veterans who served in security-related military occupational specialties. This limitation arbitrarily, I believe, disqualifies veterans who may have otherwise been exposed to toxic chemicals during their service in Thailand by transiting through the perimeter or by the toxin moving through air or water to other parts of the base. With the Thailand Toxic Exposure Bill, S-1381, Senator Tester and I seek to eliminate the barrier for veterans. For my colleagues on the committee, most of you probably received letters in the bright orange envelopes like these. Mr. Rhodes and his fellow Thailand veterans and their families have started a letter-writing campaign to make sure that we keep them at the top of our minds as we make policy. I appreciate their support, understand their urgencies, and hope that we can fix this soon. So, Dr. Hastings, within the VA's post-deployment health services, the environmental health program makes policy recommendations for health outcomes related to military exposure for Agent Orange, among other things. Let me ask you two or three things, all together, and then you can think about it. How often do you all look at your current policy to recommend updates, like to those currently limiting benefits for Thailand service? Is there any process to review claims data from claims approved, denied, and pending to identify trends that may warrant a review of presumption policies? For example, let's say there were a number of claims from veterans who had served in the interior of a Thailand base, a location not covered by the VA's current presumption. If those claims contain medical diagnosis of something like amyloidosis, one of these things that seems to be directly related to Agent Orange, are you aware of a process that would identify that trend and trigger a review policy? And then finally, when you recommend policy changes, who in the department ultimately determines whether to implement your recommendations?
Yes, sir. Thank you very much. I'd like to just comment on the Agent Orange locations, if I might. GAO asked for a report to be done by DOD and VA. DOD went to the archives and to the original manifests, et cetera. We do have a new Agent Orange list that we have just received from the DOD, and we are looking at it right now. It is with my office and with VBA, and we hope to post that soon. You asked about looking at current policy and benefits review. We review it every 2 years. It has been with the National Academy of Medicine reports. So we have 11 reports that they've given us, so we've had a review every 2 years. My office also looks at trends in between times with the registry. We look at some of the health outcomes. Recently, we were concerned about cholangiocarcinoma. There have been questions about brain cancers before, so we do look at it in the interim also. With regards to claims pending, we do look at those, for example, with the Airborne Hazards Registry. We look at the top 10 items that go in, and I routinely screen those. and see if there are any things that we might be missing or that we need to look at further. Further, we do take our registry, the Airborne Hazards Registry, and if people want to go online and see what the top complaints are, what the issues are, we have data mined that registry, and it is available for people to look at. We want to be as open and transparent as possible. With regards to policy changes, those are submitted to the leadership of VA. They do recognize that my office has the subject matter experts, and if they have further questions, they will work with us. But our policies have mainly been in the area of the exams for the veterans and how to document those for the VA and some care.
Good. We appreciate it, appreciate your hard work and look forward to working with you. But I would be interested in following up, and maybe we can get together as to, if there are trends that you've identified in regard to just the military police that worked in the area, and it's very restrictive right now. And so this is not asking that we do everybody, but it is asking that those that can build a case that have a disease directly related to, to Agent Orange, that they're able to prosecute that. So thank you very much. Thank you, Mr. Chairman.